Good afternoon, everyone. I hope everyone is doing well today. My name is Grace Yeager, and I'm here presenting my literature review titled Female Athlete Triad. I grew up an athlete, and I didn't ever really think about the correlation between nutrition and sports. And if you think about it, most athletes are uneducated about proper nutrition. When I reached my teenage years, I saw through social media the growing awareness of nutrition. Every time you scroll through a social media platform, you see more and more posts about supplements and diets. Most of these ads were specific to women, how they could make them look a certain way, like give them abs or tone their legs. So now I'm going to skip forward for a second and introduce you to the subject of the female athlete triad. This is a syndrome that only occurs in women, and it is defined as the interrelationship between disordered eating, menstrual dysfunction, and bone density loss. Title IX of the Education Amendments Act of 1972 prevented discrimination in participation of sports based on gender. Female participation in sports increased dramatically after this act was passed. As we all know, sports are competition-driven, and athletes have learned to adjust their diet and training to get ahead. They also use the drive from the gender gap to always perform their best. Women are known to compare themselves to other women. Athletes have learned to go to extreme measures to modify their physical appearance and increase their performance in sports. These measures are correlated with the development of the female athlete triad. Factors of the female athlete triad negatively affect women's health. When I think of the gender gap, I think about the difference in pay in men and women, but the gender gap also exists in sports. Female athletes are told that they will never reach the potential of men. However, women differ from men, and their unique structures allow them to be athletically efficient in their own way. The information used in my literature review was found using Google Scholar and JSU's library database. I found scholarly articles related to my topic, the female athlete triad, and I thoroughly reviewed the articles. Several of the scholarly articles I found were from journals like Medicine and Science in Sports and Exercise, Journal of Sports Medicine, Journal of Orthopedic and Sports Physical Therapy, and the American Journal of Sports Medicine. Again, the female athlete triad syndrome is the interrelationship between disordered eating, menstrual dysfunction, and bone density loss. The first review article I will mention is titled ABC of Sports and Exercise Medicine, Female Athlete Triad. This article is from a British medical journal. It touches on treatment of the female athlete triad. Treatment of the triad includes weight gain, lowering training load, and sometimes the contraceptive pill. Use of the contraceptive pill is not the first treatment implemented because there is lack of research on its benefit on treating menstrual dysfunction and bone density. Athletes, especially professional ones, tend to spend hours out of their day either practicing or working out. Gaining weight and lowering training load can benefit a female athlete with the female athlete triad syndrome. Treatment is needed to prevent malnourishment. Disordered eating is a big problem of the triad. Disordered eating is associated with symptoms such as bloating, constipation, and fatigue. Treatment should include a registered dietitian, especially when the athlete is experiencing disordered eating. There are dietitians who specialize in disordered eating, so seeing a dietitian will provide the best treatment for a female athlete with the syndrome. The next article I will review is titled The Female Athlete Triad. This article studies the interrelationship between disordered eating, menstrual dysfunction, and bone density loss. There is a study done to determine the prevalence between all three symptoms of the triad at once. The results showed that the conditions of the triad do not have to be experienced at once to cause health issues in female athletes. For example, an athlete can experience menstrual dysfunction without disordered eating and think they do not have to worry about the effects of the triad. However, each symptom of the triad causes its own health issue. The decreased energy availability in female athletes is due to increased energy expenditure from excess training. This decreased energy availability can also be related to disordered eating patterns by an athlete. Low energy availability over a period of time leads to reproductive and skeletal problems, which are both symptoms of the triad. It can be assumed that the underlying cause of the female athlete triad syndrome is low energy availability. Health screenings or physicals can be used to prevent or early diagnose the syndrome. Treatment of the syndrome involves increasing calories and decreasing training load, and it is vital for female athletes' future health. The next article I will review is titled, Understanding the Female Athlete Triad, Eating Disorders, Amenorrhea, and Osteoporosis. Disordered eating creates an energy restriction which can result in menstrual dysfunction, bone mineral loss, and osteoporosis. The prevention of bone loss is necessary because bone loss is sometimes irreplaceable. It is not healthy for young female athletes to experience bone loss at such a young age, and it can lead to bigger problems in the future. This article divides treatment options for the female athlete triad into primary, secondary, and tertiary. Primary treatment of the triad includes education of the syndrome. Secondary treatment of the triad includes early diagnosis or intervention. Early detection is essential in preventing long-term effects of the syndrome. Tertiary treatment of the syndrome includes treating athletes with eating disorders. As mentioned previously, involving a physician as well as a registered dietitian will ensure the athlete gets the best treatment possible. The next article I will review is titled, Higher Incidence of Bone Stress Injuries with Increasing Female Athlete Triad-Related Risk Factors. This article focuses on the effects of the female athlete syndrome on bone stress injuries. Bone stress injuries are common in athletes, and they are usually thought to happen to anyone at any given time. However, studies show that the prevalence of bone stress injuries in athletes are associated with the symptoms of the female athlete triad, which are disordered eating, menstrual dysfunction, and bone density loss. Athletes with the female athlete triad syndrome can experience bone density loss. Bone density loss can lead to bone stress injuries, like stress fractures or breaks. Recovery of bone stress injuries can take 6 weeks to 6 months. Formations or strains in the bones occur from stressors like weight-bearing activities. Bones cannot repair themselves without proper recovery and nutrition. Usually, if an athlete is experiencing bone stress injuries, it is related to training and nutrition. If a female athlete isn't properly nourishing her body, then recovery from these injuries can take longer than usual. Athletes with female athlete triad syndrome related risk factors are more likely to develop bone stress injuries. Early detection of those at risk for bone stress injuries can decrease recovery time from injuries. This table shows the incidence of bone stress injuries associated with one or more risk factor variables of the female athlete triad, such as disordered eating, menstrual dysfunction, and bone density loss. The more female athlete triad related risk factors an athlete has, the more likely they are to develop bone stress injuries. This table lists the warning signs and symptoms of the female athlete triad. The signs and symptoms are divided into behavioral and physical. The behavioral signs and symptoms include excessive criticism of one's body weight or shape, noticeable weight loss or gain, preoccupation with food, calories, and/or weight, compulsive excessive exercise, mood swings, depression, secretly eating or stealing food, bathroom visits after eating, avoiding food-related social activities, excessive laxative, diuretic, and/or diet pill use, consumption of large amounts of food not consistent with the athlete's weight. The physical signs and symptoms include chronic fatigue, anemia, frequent gastrointestinal problems, cold intolerance, tooth erosion, callous fingers, irregular or absent menstrual cycles, and delayed or prolonged wound and/or injury healing. This figure describes how each symptom of the female athlete triad is interrelated through physiological and psychological mechanisms. The figure shows the spectrum from normal to varying degrees of pathology for each component of the triad. Optimal energy availability leads to optimal bone health, while low energy availability, with or without disordered eating, leads to subclinical menstrual disorders, osteoporosis, and functional hypothalamic amenorrhea. To sum up the data mentioned previously, bone stress injuries correlate with risk factor variables of the female athlete triad. There are several signs and symptoms of the female athlete triad, and they can be divided into behavioral and physical. The components of the female athlete triad are related to physiological and psychological mechanisms. The pathology for each component of the female athlete triad is tied to reduced energy availability, low bone mineral density, or subclinical menstrual disorders. Today's society values thinness, especially for females. Female athletes are expected to maintain a certain physique while competing, especially those competing in physique-based sports like gymnastics or track and field. Sometimes coaches, trainers, or even parents are a part of the problem of setting expectations too high for females. These expectations can cause behaviors that can create psychological problems in the long run. In conclusion, psychological therapy can help treat those with negative body images and eating disorders. Treatment of the female athlete triad is vital for an athlete's long-term health. The female athlete triad, or the relationship between disordered eating, menstrual dysfunction, and bone density loss, is a new concept, so awareness for the syndrome should be increased for female athletes. As I mentioned earlier, one study that had treatment of the syndrome broken down into primary, secondary, and tertiary. That primary treatment was education about the syndrome. So many people are not aware, so they don't know that what they should be looking for to treat in order to treat it. That concludes my presentation on my literature review on the female athlete triad. I hope you all learned something new. I know I learned a good bit of information from completing this literature review, and thank you all for listening. Have a great day.